All right, let's look at Gabriella one last time, but this time we're going to go a little bit deeper. We're going to spend some time looking at her initial diagnostic records, kind of talking about what the thought process was on beginning with the idea that we might need a fixed functional appliance, but then seeing at the end of phase one, and as we were progressing, that she was just doing a magnificent job with her rubber bands, the arches were leveling, the molars were rotating, the buccal segments were uprighting. All of these things occurred, which started to incrementally help us fix this class two in a way that allowed us to stop and not need that fixed functional appliance. We just kind of kept going. We went through phase two and phase three. We kept our treatment a little bit longer to make sure that, we didn't have that CR-CO shift. And we ended up with a really, really nice class one at the end. So hopefully you enjoy this case as much as we enjoyed treating it. Thanks. All right, let's go through Gabriella in a little bit more detail. Gabriella was a case that we treated in about 18 months. She had a significant overjet, lots of constriction, full step class two. Our 2.0C is the treatment plan where we begin with some arch development class two elastics, in about 4 to 5 months evaluate if we need a fixed functional appliance, which in this case would have been a Herbst. So let's go ahead and kind of break this down a little bit. When we look at our comprehensive aesthetic diagnosis, torque selection, and positioning, we're just going to give us a really good setup for this case. Again, it's a pretty typical class two. She's constricted in the upper. She's got some constriction in the lower, pretty good curve speed, upper teeth are a little bit forward, and just really just an overall class two. Now, her face did lend itself to possibly a fixed functional, but again, we wanted to derotate the molars and get a little bit of arch development before I put in the fixed functional appliance. So it doesn't really hurt to begin this case and then to see what happens. Again, from the x-rays, we're waiting on eruption of the second molars, especially that lower right one. And from an x-ray standpoint, she is, definitely has class two components. So we're going to want to make sure that we take care of this, upright the upper incisors, control the torque in the lower, but we really want to make sure that we're addressing the class two. Now, in this case, we did know that we were going to have arch development in the upper, a lot of class two mechanics. So we chose procline torque in the upper. Now, the procline is going to allow the posterior development, let the upper teeth tip back. But when the upper incisor gets to 7 degrees, then that torque couple is going to kick in and going to protect that tooth from retroclining any further past 7, especially once we're in a full-size archwire. So really, the whole idea of this is just allow these teeth to find their normal position and then protect them against, quote, dumping or retroclination. And at the bottom, it's the opposite. We have a really nice curved speed, so we know that we're going to intrude these lower teeth. We're going to add class two mechanics, which has a side effect of proclining lower teeth, which is against our objective. So we're going to want to make sure that we have retroclining lower. Again, overall treatment time was about 18 months. What I want to do is just kind of get into this to see how we treated this case. So we went ahead, we positioned the brackets, okay, and her phase one was basically a traditional phase one. It was an 0-4 for 8 weeks, 0-8 for 8 weeks, 14.0275 for 2 visits, okay? Normally, we would be getting out of phase one after 1 8-week adjustment over 14.0275. In her case, I kind of wanted to see if I needed to use the Herbst. She still had a CRCO slide at about 6 months, so I just wanted to give her one more visit of class 2 elastics. She was only wearing 2-ounce elastics from the upper 4s to the lower 6s, but after 8 months, we realized quite quickly that she was looking really good and we could avoid the fixed functional because here are her photos. So you can see that really she's got a really nice class 1 occlusion. She still has a positioning issue, right? We know that she's positioning forward a little bit because as we manipulate her jaw, she has about a 3mm CRCO slide. But all in all, things are looking really great. So we decided to forego the Herbst and just finish this case with class 2 elastics. So now phase 2 is putting on our 180275s. Now we have a full expression wire in first, second, and third order. So our elastics can bump up to 3.5 ounce. We switch from the post on the tooth to the post on the wire. And really you're just looking for repositioning. So at the end of phase 2, we've repositioned some brackets. We now are looking at just finishing this case. From here, we're going to go ahead and put in some steel wires. So I take out the 180275 copper die tie upper, replace it with a steel, replace the lower with a 160275 steel, and then continue class 2 elastics. Really now all we're waiting on is for her CRCO slide to go away. So we have her come in every 6 weeks, just checking. And after about 15 months, we said you're about ready to get your braces off. And here she is in phase 3 a couple months later. This again is 1 week before debond. We decided to not bond the lower right 7 just because everything looked so good. And we just told the parents we were going to wait on that and follow it in retention. So now when we look at this, we've kind of met all of our objectives. Everything looks great. And 18 months, 12 appointments, a normal progression. We didn't lose anything once we got it. What's great about Ultima is once you check the box of a certain order, let's say first order solved, it doesn't creep back up on you. Once you click axial inclination, so second order solved, it doesn't change. And then once you finally dial in torque, you're ready to get your braces off because if we've knocked out for second, third order, we've closed spaces and we've got CRD equals CO, there's nothing left to do. So we go ahead and we look at the x-rays. Again, we're just waiting on that 7. We'll just follow it through the first year of retention. When we look at before and afters, we can see that we really went from a significant class 2 to a beautifully treated class 1. All of the boxes that I'm looking for, which is good arch form, good occlusion, and good angulation are checked. Really everything's kind of dialed in. You can see here, molars are derotated, upper arch is developed nicely to a natural arch form. This isn't overexpanded in any means. Lower arch looks good. It's upright. When we look at the progressive arch development, this is really, again, this is what we're looking at, right? We want to see this natural arch form, this lower buccal uprighting, really, really making this a beautifully treated case, because functionally, it all works beautifully when we have a nice functional occlusion. From an aesthetic standpoint, we can see that her overjet was decreasing, her arch development was improving, and really just formed into a beautiful result that fits her face nicely. And 18 months, really didn't have to work that hard. It was putting braces on properly, changing the wires, and just having her wear rubber bindons. Again, everything was really dialed in. And again, most importantly, we didn't have to add, pre-adjusted wires. We didn't have to add Warren springs. We didn't have to bend the wires. I didn't have to do a lot of things I normally had to do in a case to get this level of finish. And really, it's quite nice. 1 week before Diabond, these are what the wires look like, how they're in, everything looks great. So if you really, really like that case, I do particularly, check us out. This case is fully written up on our educational site. But again, can't wait to show you the next case. Take care. Bye-bye.